Want to hear a more diverse perspective on art? Tune in to Speaking of Art, the official podcast of Sharjah Art Foundation, featuring conversations with some of the most prominent artists and curators from Asia, Africa, and around the world. Listen to Speaking of Art wherever you get your podcasts.
FM. Joy 99.7 FM.
Your style, your smile, your personality, like a dream come true. You give me love like no other, so unselfishly. So I'm singing this song, let the whole world know. Keep on doing what you do, here's to you. Just for you. Here's to you. This song's for you. Here's to you. Just for you. Here's to you. This song's for you. Feels like I'm sitting on top of the world whenever you're around me. Pick me up when I'm down. Thank you, boy. Thank you, boy. And when we touch, can't get enough. The feeling's oh so right. One of a kind, so glad you're mine. Love you. What you do, here's to you.
Joy 99.7 FM.
Just for you. Here's to you, baby. This song's for you.
That's right, as I mentioned,
Here's to you.
the Pop Chain Records Night 2023 is coming up on Saturday the 28th of October in partnership with the Rotary Club of Accra Airport at the Gold Coast Restaurant. I'll be speaking with Dr. Ben Hagan, immediate past president of the Rotary Club Accra.
Joy 99.7 FM.
All that's good to me. Yeah, baby. Yeah. You're all that's good to me.
99.7 FM.
Keep it coming, girl. Just the other day I was thinking, reminiscing about when we first met. I was single and free, and that's the way I wanted it to be. Promise not to take another chance at romance going away like I did
Joy
before.
99.7 FM.
Ask me now what I think of you. This is what I would say to you. You're all that's good to me. Sugar and spice, all things nice, baby. You're all that's good to me. Keep it
Joy 99.7 FM.
at times I want to love.
Okay, as I mentioned, our Pop Chain Records Night 2023 is coming on this Saturday 28th
But now
at the Gold Coast Restaurant. On the line by Zoom, I have Dr. Ben Hagan. He's the immediate past president of the Rotary Club of Accra Airport. Doc, you're welcome.
Thank you. Nothing. How are you?
I'm great. And let me salute you as a senior MOBA, president of
Thank you.
MOBA 1968. I'm a wee MOBA 1981, but so great to have you this afternoon.
Good.
Right. Let's get into it with the old school in the background. We're doing this in partnership and collaboration with you, the Rotary Club, Gold Coast Restaurant and Cocktail Bar, the Millennium Promise Alliance, Cancer Support Network Foundation, and the Lady Pharmacists Association. So what's the deal for this fundraising event?
Yes. As you've rightly introduced, we are raising this funds so that we can continue with our community outreach on breast cancer awareness, and also follow up with those patients who would need some additional Medicare.
Right.
We did a similar fundraising music concert last year, and we used those funds to go to Jumaku Enyan, Isiam district in the central region, screened over 700 women. And we have at hand right now 10 ladies that we need to follow up.
Right.
With mammography and the follow-up Medicare.
Okay.
So we're just continuing with what we have already started.
Right.
We're going to work on raising funds and doing breast cancer awareness and screening for the next 5 years.
Okay.
With Joy FM and other partners.
Right. So this is the 2022 to 2026 Joint Breast Cancer Project.
Yes.
Right. And the key partners, again, just let's underscore that.
Yeah, so Rotary Club of Accra Airport is partnering with Joy FM and also Gold Coast Restaurant and Cocktail Bar. And other partners are, as you said, Cancer Support Network Foundation, Millennium Promise Alliance, and then Lady Pharmacists of Ghana, LAPAG.
Right.
And we have traditional sponsors who have been always working with us since 2015. Can you imagine? David Walter Ghana Limited, Trinity Oil, and GKV Investments, the manufacturers of Ava Virgin Coconut Oil.
All right. Great stuff. Now, for most of my listeners, right, I started with a little intro into old school. There's so much old school out there. But you've assembled a list, or should I say, a DJ's, contest across different generations, representing the schools, etc. I see Lexis Bill there, right, representing Presec. Yes. I see our own Kwabotre Bile, representing Infanspim. I see Siwa Doreen Andor, representing St. Roses and Holy Child, and then Andy Dusty, representing Prempe. This is all going down at the Gold Coast on Saturday.
Yes, the battle of old school DJs. That's what it is.
Mm-hmm. Right. So what should we expect, and then how much does it cost to take part in this? A
ticket goes for only 150 Ghana cedis.
Right.
And you can get it physical tickets from the front desk of Joy FM and also from Gold Coast Restaurant. You can also get it electronically with our short code *714 *003 *1#. And I go over it again.
Yep.
*714 *003 *1#. And you can also donate directly from your mobile phone towards our cause with the same short code.
Right. Great stuff. So by paying $150 to have fun, enjoy all your oldies with all your old school mates and all that, this money will go towards the Joint Breast Cancer Project.
That's what it is, yes.
Okay. Well, right. Great. So, Dr. Ben Hagan, what would you want to leave our listeners with as we part with you and look forward to this Saturday's jam? For many people, when they hear Popche, they're not too sure. We shifted now. The focus has shifted this time from the live band music now to the battle of the DJs. What should they expect on Saturday?
Yes. And this change of format is a direct reaction to what our patrons have been asking for.
Okay.
They come and have fun, uninterrupted music. And this time, the format that they've requested for is coming from music coming from old school DJs,
right, playing
R&B, high life, and music of the 60s, 70s, and 80s. Having fun, but at the same time, helping to raise funds for this great cause, very, very important cause
Right.
of raising awareness of breast cancer and the follow-up Medicare.
Right. So everybody should, make a date on Saturday. Gates open at 5. The event itself sets off at 7. And as we used to say in the day, Doc, is it TDB?
Joy.
Until the last person is tired and walks out of the gate of Gold Coast.
Right. Until the last person is tired and walks out of Gold Coast. So you just heard speaking there, Dr. Ben Hagan, immediate past president of the Rotary Club, Accra Airport, partnering with Joy FM, Gold Coast Restaurant and Cocktail Bar, and many other partners. I'll repeat that as we go through the program. We're still going to be talking about radiotherapy with Dr. Nadoko Aite. She's a senior specialist, clinical oncologist. We're looking at radiotherapy. All your questions, we'll take them on board. Many thanks again, Dr. Hagan.
And thank you very much for allowing us to reach our patrons. Thanks.
Great stuff. Yeah, we'll do that, and we'll be with you on Saturday. It's going to be a whopper. Yeah, join the pop chain this Saturday, 28th. These songs and many more, but right now I'm back in the studio and going to be looking at radiotherapy. Last week we did a lot on chemotherapy, more systemic, dealing with cancer cells. In a systemic way. Today we're talking about radiotherapy, and I have on Zoom or via Zoom Dr. Nadoko Aite. She's a senior specialist clinical oncologist with the Kolebu Teaching Hospital. At the moment she's out, should I say on duty, or on business in Madrid, but she's kindly joined us via Zoom. Doc, good afternoon.
Hi, good afternoon, Otis.
Hi, how are you doing?
How are you? I'm great, thank you very much. How are you doing?
I'm doing good, though. I'm trying to play some old school. There's an effort to, raise funds towards breast cancer screening awareness and some, should I say, initial treatment for some very, very lucky women in Ghana. So,
always a good cause.
Right. And you yourself, I know, are planning something with regard to prostate cancer. But when you get back from Madrid, then we'll talk about that as well.
Yes, we'll be happy to talk to you about it.
Okay.
It's about time we spoke to the men as well.
Right. We understand. We're ready for you. But the topic for today, we're looking at radiotherapy with regard to breast cancer treatment. It's one of the known treatment modalities. Can you, bring us up to speed? When we say radiotherapy, what exactly do we mean?
All right. So, radiation, much like light waves or radio waves, uses high energy to kill cancer cells, basically. So, in the electromagnetic spectrum, there are some waves that have high energy. And what we do with radiotherapy is that we direct those waves to the area where the cancer cells are likely to be. Even after you've done surgery, you've done chemotherapy, there still might be some cancer cells that our eyes may not be able to see. Right. And that's what radiation does. We direct the radiation to that site to kill the cancer cells there. Okay. But also the interesting thing is that not only do the cancer cells there die, there's also a lot of evidence that shows that cancer cells outside of that space can also die. Right. So even though the treatment is local, there's death in the rest of the body as well, cancer cells.
Okay. Right. Now, for many people, they are concerned when they hear about radiotherapy is about untoward outcomes or side effects and so on. We'll get to that in a second. But what you're telling us is that we're targeting radio waves at cancer cells. How are we able to target? Because that will lead us also to the mode of, should I say, practice or the strategies or the types of radiotherapy. But how are we able to do this? How is this done?
Okay, so we are not using radio waves. No, we are using radiation.
Radiation, sorry.
Mainly gamma rays. Yes. Radio waves they don't have enough energy.
Okay.
So we're using gamma rays, X-rays, basically. Yes. And so there are various ways in which we deliver radiotherapy. There's the common one called external beam radiotherapy.
Right.
In this type of radiotherapy, the patient lies away from the radiotherapy machine. So the radiation is delivered by a machine.
Right.
And the patient is positioned away from the machine. And what we do is that we direct the rays to the side.
Mm-hmm.
And then it's delivered. So that's external beam radiotherapy. And we can give this to the whole breast.
Right.
If you've done surgery to remove just the breast cancer. Or we can use that for when you've done an operation to remove all of the breast because the cancer may be more advanced.
Okay.
So that's one type, external beam radiotherapy. But you can also have what we call internal radiotherapy, also known as brachytherapy,
Right.
where you actually insert some equipment into the breast, and then the radiation is delivered over a period,
Okay.
usually about 5 or 10 days. Unlike the external beam, that can go on for longer. It can be up to 5 weeks.
Right.
But the brachytherapy is shorter, and the radiation is actually in contact with the site where you are doing the treatment.
Okay. Right. Now, for most of my listeners, the first thing they'll ask listening to you, Dr. Ayite, is are these available in Ghana as we speak? Okay, the external beam, you say, is the more common, more familiar one. And then, of course, the internal radiation or brachytherapy. Are these, should I say, methods and treatment modalities all available in Ghana?
They are all available in Ghana.
Okay. And
They are available in Accra. They are available in Kumasi. We'd like to say they are available in all the regions, but we are not there yet. We hope to get there very soon.
right.
But yes, you certainly have it in Ghana.
Okay. Now, also, my reading and viewing suggests to me that it's a most likely form of treatment or intervention in breast cancer, even though you may have some of the others, hormonal, chemical, chemotherapy, and others. Can you explain that to us? It seems to suggest that even though you may have undergone some of the other modalities, some say or suggest that radiotherapy is becoming or is the standard when it comes to breast cancer treatment.
Yes. So, Notte, I'm sure in your previous discussions, you talked about the fact that breast cancer is a systemic disease.
Right.
So even though breast cancer affects the breast, there's evidence that the disease can be elsewhere in your body. It's the reason why just removing the lump is not enough, right? So we give chemotherapy as well.
Right.
Now, radiotherapy is an additional treatment for after you've done all of these things. What happens is that, especially when you've had surgery to remove only a part of the breast,
Mm-hmm.
we know that sometimes cancer cells may be left behind. These are cancer cells that we may not even be able to see under the microscope. We call subclinical disease.
Right.
But we know they are there. So the radiation therapy goes to add to the other treatments you've had to reduce the chances of the cancer coming back in that breast.
Okay.
Or if you've had mastectomy, in the area where the breast used to be, that's your chest wall.
Mm.
And this is important because if we prevent the cancer from coming back within the breast or in the chest wall, we are reducing the likelihood of the cancer coming back everywhere else in the body,
Okay.
so that you are unlikely to die from cancer. So that's the benefit for radiotherapy.
Okay. Folks, if you just joined me, it's 26 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday with me, Norte by Nature. I'm speaking with Dr. Nadoko Aite. She's a senior specialist clinical oncologist with the Kolibu Teaching Hospital, and she's speaking to us via Zoom from Madrid. But we're talking about radiotherapy, right? And its role in the treatment of cancer. If you have any questions, concerns, my WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Today, Maryland tells me that the YouTube is a bit slow. It's been sorted now, right? Okay, Abiku's working on that. We're live on Facebook and YouTube. You can share your questions and concerns to Dr. Nadoko Aite, clinical oncologist. Earlier, we spoke to Dr. Ben Hagen of the Rotary Club, Accra Airport. They are organizing in partnership with Joy FM and a few other partners. I'll go over the partners. The Pop Chain this Saturday at 5 p.m. Gold Coast Restaurant and Cocktail Bar. There's a pop chain featuring all a selection of old school DJs, Belay, Lexus, Doreen Andor, Andy Dusty, and you've got to be there to help raise funds for breast cancer awareness screening and some initial treatment efforts as well. This is part of the 2022 to 2026 Joint Breast Cancer Project. So if you have any questions, concerns on radiotherapy, 055 11 11 997. We're live on Facebook and YouTube. So, Doc, if you're still with me, I hope so. So after you have lumpectomy or mastectomy, you've had some of the tumor or all of it removed, you're suggesting that the next line is to make sure that we can prevent the recurrence using radiotherapy. And you've talked about the two types or the two modalities. That's where we were before I gave the summary. Who is likely, or at what stage would you introduce, or is radiotherapy likely to be introduced?
For stage 0 breast cancer, you might actually need radiotherapy as well to reduce the chances of the cancer coming back. Yes.
Right.
So about half of our patients will need radiotherapy as part of their treatment.
Right. Okay. So when it comes to the addition or the inclusion of radiotherapy, there's a lot of anxiety, there's a lot of misinformation, there are a lot of myths, and maybe, should I say, almost hysteria when it comes to radiotherapy. Now, you mentioned 0 stage or, the non-invasive cancers or tumors that we may be talking about. Are you suggesting that with radiotherapy, if the cancer has spread beyond the breast and breast tissue, it's still an important modality?
It is. So whether the cancer is limited to the breast or is gone outside of the breast, radiotherapy is an important part of your treatment. So for the early stage, if you've done just a lumpectomy as the local treatment for your breast cancer, then for a comprehensive treatment, radiotherapy must be part of it. So anybody who has cancer, whatever the stage is, if you have only a part of the breast removed, then for comprehensive treatment, that's breast conserving therapy, you must have radiotherapy.
Okay.
Then there's the other group of patients who have more advanced
Joy,
disease and so
99.7
have
FM.
all of the breast removed by mastectomy.
Right.
For those groups of patients, they also must have radiotherapy to the chest wall. The only group that they don't need radiotherapy are those who have early stage disease but have mastectomy. Right? So the disease is early, but they have all of the breast removed. Those groups of patients usually may not need radiotherapy as part of their treatment.
Okay. Right. Now, I know there are pros and cons and there are different relative or comparative advantages and maybe call them disadvantages. But in a case where a patient has undergone chemotherapy, which we got to understand last week from Drs. Aite and Mark Dradosi, is systemic. So the chemicals go everywhere in the body. right? We're saying that even after chemotherapy, which is systemic and is assumed to work throughout the body, targeting these abnormal cells and tumors, we will still require radiotherapy, which is targeted. How do we know what is left after chemotherapy? I know there's a lot of imaging and other techniques involved, but what gives you the target spots, so to speak, to address or target with the radiotherapy?
So, you really don't need any special investigation after you've received the initial treatment to decide if the patient needs radiotherapy or not. In fact, at the time we make the diagnosis, when we decide what stage your cancer is, the decision for the need for radiotherapy is made then, depending on the type of surgery you would have. So we don't need to do any special test to decide that this patient needs radiotherapy or not.
Okay.
The decision is made when we know what stage of disease you have and the type of surgery you would have. Yes.
Right. Okay. Right. If you just joined us, it's 33 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Naughty by Nature. We're talking about breast cancer treatment. We've dedicated the whole month of October. We've gone pink, so to speak, to breast cancer. Today we're looking at treatment modalities, and we're focusing or zooming in on radiotherapy with a clinical senior specialist clinical oncologist, Dr. Na Adoko Aite. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and the phone line 0302 216 541 0302 216 541. We'll move forward and address some of the myths and misconceptions and a few other things about the basic procedure, what to expect. My reading, my viewing suggests that it is painless. I was a bit surprised when I found that out. I also read some stuff which suggests that typically radiotherapy would not cause hair loss. Dr. Aite will handle some of those things as we move ahead. Remember, WhatsApp 055 11 11 997. We're live on Facebook and YouTube, and the phone line 030 221 6541.
Joy 99.7 FM.
Right, Dr. Aite. So coming back again, targeted radiotherapy. I understand now technology is so far advanced that it can be pinpoint almost bullseye, if not bullseye, with regard to the regions or the areas of tissue that have to receive the radiotherapy or the waves involved. Can you explain that to my listeners? Because many people want to understand, well, how do you protect areas which are okay? And how do you prevent collateral damage to cells that are normal and not cancerous?
Okay, so I'm excited you've asked this question. Let me say something about the different ways in which cancer cells and normal cells behave.
Okay.
It's this difference that we take advantage of for radiotherapy. So for the cancer cells, the abnormal cells, the most important thing for them is growing, right? So multiplying in number. They usually are not interested in making sure that the new cells that are produced are healthy in food, right? So all they are interested in is growing. For normal cells, however, it's important for the normal cell that if there's any abnormality within the cell, that it is corrected. Now, when we give radiation to cells, it causes damage in the DNA. Now, this damage that is caused in a normal cell, the cell will stop growing and make corrections to that damage.
Okay.
Once the correction is made, then the body will allow the cell to go through and then divide some more.
Okay.
When it comes to cancer cells, that's wasting time to make the corrections. They don't do.
Okay.
So the damage that the radiation causes, actually in the end, causes the cell to die because the damage is not corrected.
Okay.
Right. So even if there are side effects to radiotherapy, often the normal cells will recover, but the abnormal cells will not.
Right.
Now, these days, we actually use what we call three-dimensional three-dimensional conformal radiotherapy.
Right.
What happens is that the area where we need to treat, whether it's the breast or the chest wall, we take CT scans of the area.
Mm-hmm.
And then using a machine called the treatment planning system, we actually isolate the areas. So if it's the breast, we isolate the breast by drawing contours around the breast.
Okay.
Once we've done that, then a physicist will come up with a plan by directing the radiation waves to the area where we want to treat. In fact, these days, there's also what we call IMRT, where you tell a machine what you want it to do.
Right.
And it's available in Accra.
Mm-hmm.
And the machine will come up with a plan
Mm-hmm.
that ensures that only the area we want to target is treated.
Right.
The surrounding areas, the machine or the physicist makes a conscious effort to avoid those areas.
Okay.
Plus, there are guidelines to the maximum and the minimum that the areas around it should receive.
Okay.
And these are strictly adhered to make sure that there are no side effects, or if there would be, there are very few side effects.
Okie dokie. Right. So advanced therapy, advanced science ensures that, should I say, the optimum dose and the minimal, should I say, side effects or
Damage,
negative outcomes ensue. So you're safe, and all of this, folks listening to me, is available here in our country, and we have the specialists. Maybe later I'll ask how many of them there are, but we have the specialists to administer this form of treatment, radiotherapy, to you effectively and safely. If you have any questions, concerns, WhatsApp is 055 1111 997. My phone line is active. Abeku, do I have anything on WhatsApp? If I can just shift from the Zoom screen and have a look and read out a couple of those. Okie dokie. People are in business already. This one says, good afternoon, Norte. Please, we all know that the services rendered by Kolebu Hospital is relatively cheaper, and breast cancer is synonymous with mammogram. But it is alleged that mammogram machines at the hospital are not functioning. Is it possible to verify this for us? This is from Efua in Osu. I hope Doc can hear me and note down these questions as I read through them. Let me see. Which is... Okay. These are not with me. Abeku, can we... Please, is radiotherapy more effective than chemotherapy? In terms of comprehensive treatment, how affordable is it to ordinary patients? All right. No name there, but we'll address that. This one says, good afternoon, Norte. How are you and doctor? Please, apart from cancer cells that we want to be eliminated from the body of the person using radiotherapy, how do other cells that are destroyed by action come back to life again? Hayford in Bato, I hope you're recovering from the flood you mentioned, or the flood impact you mentioned last week. Dr. Ayete has addressed that. The normal cells will rejuvenate, and the abnormal cells are unable to survive what the radiotherapy does to them, so that is how they rejuvenate and restore. All right, so that answers that. This one says, hello, Doc. I lost my sister to breast cancer in 2022. She had her left breast removed or taken off, and she was told that every cancer cell was taken out. Only a few years after the surgery, she had to undergo another surgery. She was going for monthly chemo and checkups, but she wasn't told the cell had spread across her system, which got to a point that nothing could be done. This is a worry because my granny passed through cancer, and my auntie and my sister. What can I do apart from the regular checks to avoid getting it? This is from Mausi in Pokwase. I think, Abeku, I've read all. Yep. Doc Ayete, can we address some of these things? The first one was about mammogram not working in Kolebu. Are you able to give us an update on that?
Unfortunately, I'm not.
Okay.
I can't say for sure.
Right.
But if it's not working, I'm sure they're working on it.
Okie dokie. Hayford wanted some re-clarification about healthy cells rejuvenating and restoring themselves after radiotherapy. I think you explained that earlier.
Yes, that we spoke about, yes. The damage for the cancer cells, those are not repaired.
Okay.
And so they would die, but the normal cells would recover.
Okay. I have a question asking comparatively, which is more effective? I think it's Pa Solo from Doma Ahinkro. Radiotherapy or chemotherapy? People want a comparative, shall I say, analysis.
Yes. Unfortunately, we don't get to do that. It's not one or the other.
Okay.
It's usually the two together.
Right.
Yes. So the chemotherapy is systemic. It goes around the body to kill all the cancer cells that may have spread. And the radiotherapy is more localized treatment to add on to the surgery for the cells that are subclinical that we may never find, even if we look at it under the microscope. Okie
dokie. Right. Thank you, Doc. And then there was a lady, I believe a lady, sharing the experience of her sister. She sadly lost her sister, right? She lost her in 2022, but she'd already had left breast taken off and was told or given feedback that every cancer cell had been taken out in the mastectomy. Only a few years after the surgery, she had to undergo yet another surgery. After that, she was going for monthly chemo and checkups, but wasn't told from this sister's, from Mausi's report, that the cells had spread across her system to a point where nothing much could be done. She said this is a worry to her, Mausi, who's sharing this, because she lost her grandmother and an aunt and a sister. Currently, she does her regular checks. What else should she be doing?
Okay, so there are actually two parts of Mausi's question.
Right.
Right. The first one is in relation to her sister and the cancer progressing even after she had had adequate treatment.
Right.
So one of the reasons why we say let's find your cancer early is because in a population of small cancer cells, the inherent differences within the cells are few.
Right.
So that the treatment we give is most likely to deal with the cancer completely.
Okay.
If you have a bigger cancer that is more than 5 centimeters,
right,
there are different clones of cells in there, which means that you need multiple things to deal with all of these different cancer cells, right?
Right.
The other thing you need to understand is that we don't have tests that are comprehensive enough to find every single small cell.
Right.
That is abnormal.
Okay.
And also the truth is that even if you have one abnormal cell left in the body, and it can take up to 20 years, 30 years, given the right conditions, that one cell will be able to go back into a cancer. It's the reason why even when we finish treating you for cancer, we never let you go away completely. We continue to follow you up. So there's always a small probability that the cancer can come back.
Right.
So for her sister, it just could have meant that the cancer was big. And so even though all of the treatment was given, a few of the cells survived, and over time they grew back. I'm so sorry that she lost her. But there's a lot that she can do for herself.
Right.
She's spoken about multiple relatives and first-degree relatives haven't had breast cancer. That means she is at risk of having breast cancer.
Okay.
Her daughters will be at risk of having breast cancer as well.
Right.
So for her, there may be some genetic reason for the cancer.
Okay.
And there are tests that we can do to find out if she has that genetic abnormality.
Okay. Right. So
the other thing that she can do is regular mammogram so that we can find her cancer early and intervene quickly.
Okay.
At a point where it's small. But there's also some other things that can be done. And I'm sure most of you have heard about the Angelina Jolie effect.
Yeah.
Where people who have genetic predisposition to cancer can actually prevent the cancer from coming by removing the breast.
Right.
Even at the time when there's no cancer. So that is also an option. It reduces the risk quite a bit, but it's not completely removed because there are other cancers that can arise because of that genetic abnormality as well.
Right.
But so she should regularly do her mammogram.
Right.
see her doctor if it's possible for the test. And then we'll take it from there.
Right. 47 minutes past the hour, 2 on Joy 99.7 FM. Ultimate Health. We're talking about radiotherapy with Dr. Nadoko Aite, senior specialist clinical oncologist with the Korle Bu Teaching Hospital. Just responding to some of the WhatsApp messages if you have any. The WhatsApp is 055 11 11 997. Phone line 030-221-6541. We're live on Facebook. For those who are having problems, Facebook and YouTube have been restored. They're in Maryland. I hope that sorts you out. But Doc Aite, you will agree with me that the Angelina Jolie example is a rather extreme one. She's quite loaded, but she chose based on family history and the genetics of it to have both breasts removed, even though she didn't have cancer. And life has continued for her, should I say, on a high profile. But for the average woman, that's a bit of an extreme leap of faith. But I understand why you put that in there for Mausi. Let's look again at the... okay, I have a caller on the phone line. We'll look at some of the risks factors and then some of the side effects of radiotherapy. I have a caller. Hello, good afternoon.
Good afternoon, Naughty.
Right, good afternoon. Who am I speaking to?
Claude. I'm calling from Tema.
Claude from Tema. You're most welcome. Share with us.
Yes, Naughty, I want to know. They always say it's genetic, but is there the possibility that exposure to certain chemicals, these days we have a lot of exposure to chemicals in food, paint, makeups and things. Over a long period, can they trigger cancer? Okay,
good question. Claude wants to know, apart from these genetic or familial indicators and, should I say, antecedents, can you be exposed to chemicals or other things through food, etc., that could cause breast cancer, Dr. Aite?
Right. So, in fact, when it comes to genetics, only 10 to 15% of patients with breast cancer actually have a genetic predisposition. For majority of our cancer patients, they are sporadic. They may not have any family history at all, right? But the important risk factors are being a female,
okay, yeah,
growing.
So age, being yes. Female, right?
Your sex,
yeah,
yes, exactly. Your reproductive history, so being nulliparous, not having a child at all.
If you haven't had a child,
your risk.
Right.
You have increased risk, yes.
Okay.
If you have your first child at an older age, above age 35,
right,
you have increased risk as well.
Okay.
Being obese,
mm-hmm,
is a risk factor, not exercising. It's a risk factor.
Okay.
When it comes to chemicals, we don't have any, well, maybe the carcinogens from cigarette smoking and alcohol.
Right.
They put you at risk of developing breast cancer. But currently, we don't have any evidence of chemicals in makeup or any of the things that Claude mentioned that puts you at risk of developing breast cancer specifically.
Okay.
Maybe other cancers, but not breast cancer.
Okay, great stuff. All right, we have about 10 minutes to go. I'm trying to squeeze all the juice from Dr. Aite before I let her go. She's joining us via Zoom from Madrid in Spain. Doc, are there any risks? And then can we talk about side effects of chemotherapy? I know there are lots of benefits that you've already, should I say, alluded to, but let's talk about risks and side effects.
Yes, of radiotherapy.
Yes.
So, radiotherapy is usually delivered in daily doses.
Okay.
Over a period of between 3 to 5 weeks. In the beginning of radiotherapy, everybody had radiotherapy for 5 weeks. So you came to the hospital every Monday to Friday, and then you did that 5 consecutive weeks. These days, we found other ways of delivering the radiotherapy over a shorter time.
Okay.
So some people receive it over 3 weeks. And in fact, there are even ways of giving you the radiotherapy within just 1 week.
Okay.
So it doesn't take too much time. So time is one of the problems with radiotherapy, but it doesn't take long.
Mm-hmm.
The treatment itself will take maybe 15, 20 minutes. You get to the hospital, you are positioned, you receive the radiation, and you go. You can't actually even go to work after that.
Okay.
But it does have a few side effects.
Right.
And the side effects can be grouped into two. There's the acute one, which happens while you are receiving the treatment and up to 6 months after the treatment.
Okay.
And then you can have the chronic. So the acute one of the commonest things that patients complain about is tiredness, fatigue.
Fatigue, right.
Yes. So as part of the radiotherapy, patients complain that they feel like they are tired or the muscle feels a bit weak. We know that can happen. And in fact, the way to counteract that is to do a bit of exercise.
Okay.
That actually improves the fatigue. Then while you are receiving the radiotherapy as well, the area where we are treating can develop some ulceration. The radiotherapy itself is not painful.
All right.
When you deliver it, no pain at all. It's like doing a CT scan.
Okay.
But over time, because the DNA in the cells are being damaged, the cells can become ulcerated. The skin can become ulcerated, right?
Okay.
What we call disformation.
Okay.
And it can be dry or it can be moist.
So,
But it's superficial and
Right.
heals quickly.
right.
So often your doctor will give you a break from the treatment.
Okay.
You recover and then you resume the treatment.
Okay. Can we cluster
Then
all
when-
these under skin irritation or reactions of the skin at the site of delivery?
Yes,
Okay.
correct. You
All
can
right.
say that.
Okay. Right.
Then you can have some side effects much later,
Mm-hmm.
what we call the chronic side effects.
Mm.
And that includes changes in the skin of the breast or the chest wall.
Okay.
So the skin may become a little thicker or a little heavier.
Mm-hmm.
Sometimes the skin may become darker or lighter, so hypopigmented or hyperpigmented.
Right.
Then the roof, which lies immediately behind the breast,
Mm-hmm.
can also receive radiotherapy and become a little brittle
Right.
compared to the side that has not received any radiotherapy at all. So those are some of the side effects that you may have to look out for
Okay.
when you receive radiotherapy.
Right.
All of them are treatable, though, I must say.
Okay. Dede was asking, you seem to mention the possibility, of the person with a family history having her daughters have cancer as well. But she says you left out sons. If we know that men can also have breast cancer.
Yeah, actually, men can. It's just that the likelihood is much lower than
Right.
women. If you took 100 people with breast cancer, 99 of them will be women. Only 1% will be a man.
Right.
So yes, the sons are at risk as well, but the daughters more than the sons.
Okay, right, great. Now, I mean, I'm a bit, should I say, cautious to ask this, but many people look towards cure, and they very rarely hear this word applied in association with cancer or breast cancer. With the effectiveness of radiotherapy and all that we hear, are we able to talk of cure in some instances? And if we are, why do we get these recurrences that surprise people, especially gleaning from the example Mausi shared from her family?
Not say, when it comes to cancer and cure, well, so the aim of our treatment, right,
Mm-hmm.
is to make sure that for the rest of your life, the cancer doesn't come back.
Mm-hmm.
Yes, or that you may die from a competing risk. So
Right.
Something else may be the cause of your death.
Okay.
At the time, if you pass without any cancer, you have been cured.
Mm.
But because there's always a probability
Mm.
that even one cell has the ability to grow back, we hesitate to say that you are cured.
Right.
We'll probably say that it appears all the cancer is gone,
Mm-hmm.
but we'll never tell you to go home and never come back to see us.
Okay.
The way we do for malaria, for example,
Mm.
we cannot do that for cancer. And especially if the cancer is advanced at the time we see you.
Right.
And unfortunately, majority of our patients come to us with locally advanced disease. Those who come early, a lot of the time, we see them for the first 5 years, they are doing well. We say, once in a while, come and show yourselves to us.
Right.
But if you have advanced disease, we cannot say that to you.
Okay. So we are cautiously hopeful. We can eliminate most of the abnormal cells, but to actually put that word cure on things, we'd rather remain cautiously vigilant.
All right.
Right. Now, this 5-year span, it seems to be such an important indicator, 5-year survival. Can you explain that to my listeners, even though we've got only a few minutes left? When we say 5-year survival, of that 5-year mark, what's the big deal about the 5 years? Doesn't it sound a bit scary that I've undergone treatment, but I have this 5-year thing hanging over my head?
Right. So, nothing. Cancer after treatment, the first 3 years,
right,
up to about 5 years,
mm-hmm,
that's the time when the person is most vulnerable for the cancer to recur.
Right.
And so the 5-year mark is very important to us.
Mm-hmm.
If your cancer doesn't recur within the first 5 years after your treatment,
okay,
it's unlikely to come back.
Can you say that again slowly, though?
And
no, say that again. I like it, but say it again.
yes, so I'm saying that within the first 3 to 5 years post-treatment,
Yep.
that's the most likely time that your cancer is going to recur.
Okay.
So often when you've gone past the 5-year mark, the cancer is most unlikely to come back.
Mm-hmm. Okay. It's unlikely.
So 5 years it is unlikely to come back.
Okay.
So the 5-year mark is very important to us.
Okay.
It also helps us to estimate the likelihood that your cancer may come back. So for very early stage disease, stage 1 and stage 2,
Right.
at 5 years, more than 90% of the patients will still be alive without the cancer having come back.
Okay.
But if you have more advanced disease, stage 3 and stage 4 at 5 years,
Mm.
you have only about 50% of the patients alive.
Okay. So,
So that's the other benefit of looking at the 5-year mark.
right. It gives us a sense of prognosis or outlook. And,
Correct.
right, the earlier you come, the better and more positive the outlook.
That is true, nothing.
Okie dokie. Folks, we're wrapping up with Dr. Aiti. I've got Dede